Hello and welcome to Healthy Living. Dr. Pelto here. Today I'm going to go over a few of the questions that we had this week from some patients. So just hold tight and I'll show you some things here. So this is some patients that came in for just some ugly toenails in the summer and some options that we gave them to make them look pretty. This patient already had laser treatment. This is a patient that had a procedure to bring down the toe. It's called a Z-plasty, where we actually lengthened the tissue to bring down the toe, and she's having some scar issues. And this was a kind of a wart patient. There's some other ones we'll go through today. Let's start with this first. This was a question that a patient asked me about ABVD, which is a cancer treatment, and they had a toenail abscess and toenail loss and then some neuropathy. Let's first talk about the toenail problems. Whether it be a toenail abscess or toenail loss, what happens is the nail gets loosened underneath it. And a lot of times you have to trim back this bad toenail or even remove the whole toenail. That's the best option for patients when the toenail is loose. If it's still attached, you leave it on. If it's loose, you trim it back. And then if it's totally loose or ingrown with an abscess or an infection, you pull off the toenail. So here's a couple of examples. The patient that asked the question didn't send me a picture, but these are some pictures that I found very similar. Once the nail's off, it takes about 9 months for it to grow back. If there is a little bit of thickening on the nail base, sometimes I use a urea cream to soften the nail base as the new nail grows out. If it's abnormal or fungal, then we can treat that later on. Neuropathy, that's a very challenging issue with chemotherapy, and it's really beyond the scope of this. You could talk to your neurologist, you could try some supplementation. I'll put a few links here on the bottom of the video to help give some options of some vitamins and things that you can try with it. But neuropathy is very challenging. There's medications and there's non-medications, but I'll give some options underneath it on the video. Patient here that wanted to wear sandals with confidence. Again, this patient hadn't worn sandals for about 5 years because she thought that her nail looked ugly. And I have a lot of patients like this. They think their nail looks ugly. The nail is cleared of fungus. We did laser on this patient, and I think she may have been an oral antifungal, but she had some nail bed thickening or scarring, and the nail kind of grows crooked. So what we did is we did something called Keryflex. Basically, I just fill this in with an epoxy and makes it look better. It's not perfect when it's filed down, but when it's painted, it looks 100% better than this for this patient. So I'll try to get you a follow-up picture when she comes in with her nails painted. Also, there's some information I'll put about Keryflex if you want to learn more in the notes of the show. Wart combo therapy. Basically, this is my best treatment at this time. There's a lot of other treatments out there, but my go-to right now, you'll ask me, doctor, what do you do? I do combo therapy. I do laser. We have a Cutera laser. I do about 3 zaps in each location. So maybe 3 here, 3 here, 3 here, 3 here, and then 3 here. And then I also put on top of that cantharidin or Ingrown, which is Beetlejuice, we call it. And that's going to cause the blistering is going to be from the laser, and the cantharidin is going to cause, this black and blue. This is from the laser, and then the blistering is going to be caused by the cantharidin. That's what I do. That's most effective, in my opinion, for someone that doesn't want them removed. There are other treatment options. I'll put a couple other videos in the show notes. You can learn more. Once again, people are coming in now today about for toenails because they want to wear sandals. They're embarrassed. You could just paint this. This patient has had this for years. A few things to think about, though. This second toe is a lot longer than the other toes, so trauma could be caused by it. So I do recommend anatomic shoes. A few of the brands I like are Lems or Ultras or Vivo Barefoot, other types of brands that are very wide in the toe box. With this, I took a sample because that trauma to the tip of the second toe that's being long, and the reason she had this toe that's short actually is because of her bunion. You can't see that here. But we recommended taking a nail sample, and then if it is a fungus, then we are going to go possibly for laser nail treatment. My protocol is always changing. I have both a Cutera and a Lunula, and I kind of do combination therapy with both of them. Is it necessary? I don't know, but it's the best thing that I have right now. I didn't find which is one or the other. It's great. So I put them together, and I do it after I get the positive nail sample 6 weeks later. And then I evaluate at 12 weeks. If I'm seeing some improvement, I might do a couple more sessions. If I'm not seeing improvement, I may switch to either pulling off the nail or doing an antifungal, an oral antifungal. That's kind of how I treat for fungal nails. If you want to learn more, once again, I'll put some more treatments for you to learn more. And then the next patient, this patient had this procedure where I fixed her bunion and this toe was really cocked up. And so I brought it down with this procedure. But then she had a lot of scarring and the scarring was a little bit painful. So I've been doing laser scar treatment once again with the Cutera. And it takes a number of treatments. It helps kind of soften the skin, bring it down. You could also use Mederma and some other things for scars. There's a lot of other treatment options. Laser is just one of them that you can do. And if you have your own question, please ask me. You can use this QR code to scan it. I love the questions. You can also post on one of my videos a question underneath, and I will try to answer it. Okay, you can ask it also on drpelto.com. Go there. Hope you enjoyed. I'm going to put some notes in the show notes underneath. So if you want to learn more, I'd be happy to share that with you. Thank you. Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.